As at last week, we rounded up on disaster and risk management. That was in chapter 2 of the material, public and community health care management. Public and community health care management. Okay. So we talk much on disaster and risk management. So as at today, or tonight rather, I would want us to look at information technology in healthcare. Information technology in healthcare. Information technology in healthcare. Information technology in healthcare. What does this mean? Information technology, which is simply known to be abbreviated to IT, is the application of computers and telecommunications equipment to store, to retrieve, to transmit, and manipulate data, often in the context of a business or other enterprise. Information technology is the application of computers and telecommunications equipment used in storing, in retrieving, in transmitting, and manipulating data. And in such technology, we make use of hardware and software. We make use of hardware and software in computer. Okay, so there is a term known as managed healthcare. Managed healthcare, as in the word manage. Managed, as the name implies. Managed healthcare is a system that integrates the financing and delivery of appropriate healthcare using a comprehensive set of services. Managed healthcare is a system that integrates the financing and delivery of appropriate healthcare using a comprehensive set of services. Managed healthcare is a method of organizing healthcare providers to achieve the goals of controlling healthcare costs and managing care and quality of care. And managing quality of care. Okay. Let's quickly go straight to the chapter 3, starting with public health administration. Public health administration is the management of people and programs in the field of public health. It also refers to as public health management. You can also say it is the component of the field of public health that concentrates on management of people and programs. Whichever way you put it. Component of the field of public health that concentrates on management of people and program. In fact, the field of administration is concerned with theory and techniques derived from a variety of fields, mainly management. All right. Let's go to epidemiology. I think we have done this. Yes, we've done this. Let us not waste time on this again. We have done anatomy, we have done physiology. We have talked about medical terminology, so let us not go back. We have done medical terminology. I think we should go to chapter 4 today. Let's quickly go to chapter 4. So we'll be talking on inventory control in the hospital. 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 That is in chapter 4. What do we mean by inventory? Inventory is defined as the sum of the value on raw materials and goods at any given point in time. Inventory is defined as the sum of the value of raw materials and goods that are stocked at any given point of time. That's an inventory. Raw materials, goods that are already stocked at any given point in time, that's an inventory. So when we now say inventory control, what do we mean by that? Inventory control is a scientific process by which an organization is supplied with goods and services that is needed for a specific period of time. It's a scientific process by which an organization is supplied with goods and services that is needed for a specific period of time. That is control. A scientific process by which an organization is supplied with goods and services that is needed for a specific period of time. That is, the process of stocking your store within a specific period of time is known to be inventory control. Now we have different types, or let me say several types of selective inventory control. Several types of selective inventory control. Don't be bothered about the word selective. Just understand it as inventory control. The word selective there is just a word. So let us just stand on inventory control. Okay? There is something we call ABC. ABC. That is based on cost criteria. That is annual consumption cost of the items does not depend on unit price of the item. Hence, it is known as always better control. Always better control. Always better control. That is the meaning of ABC under the types. So if you are listing the types of inventory control, the moment you write ABC, you must understand the meaning. Always better control. That is, the annual consumption cost of the items does not depend on the unit price of the item. The annual consumption cost of the items does not depend on the unit price of the item. That is known to be always better control. Then the second one, VED. VED. See, desirable, this one means vital, essential, desirable, based on importance. Vital, essential, and desirable, based on importance. I repeat, VED stands for vital, essential, and desire. Let me use the word desire. Let me not bother you with desirable. Based on importance, criticality, and shortage cost of the item in terms of availability. In terms of availability. So VED stands for vital, essential, and desire. So that is number 2 type of inventory control. There's another thing we call HML. HML. What is the full meaning of this? High, medium, and low. High, medium, and low. High, medium, and low. This one is based on unit price and does not depend on consumption. HML is based on unit price but does not depend on consumption. So we have gotten 3 types now: ABC, which is always better control; VED, which has to do with vital, essential, and desire; HML, which is based on unit price but does not depend on consumption. Then we have SDE. SDE. This one stands for scarce, difficult, and easy to obtain. Scarce, difficult, and easy to obtain. Scarce, difficult, and easy to obtain. It has to do with purchasing items with respect to availability. It has to do with purchasing terms with respect to availability. Then there is something we call GOLF, GOLF, which is number 5 now. That one stands for government, ordinary, and local foreign, based on source of supply from which material is procured. Government, ordinary, local, and foreign, based on source of supply from which material is procured. That one is GOLF, which is number 5. Number 6, we have what we call FSN. That is fast moving, slow moving, and non-moving, based on issues from stores. FSN, that is fast moving, slow moving, and non-moving. This one is based on issues from the stores. Then we have SYZ. SYZ. This one is based on the value of inventory stored. It is based on the inventory stored. Don't bother yourself about the full meaning of SYZ. In this one, just know it as SYZ, based on the value of inventory stored. Then the last one, which is number 8, seasonal, we have SOS, which means seasonal, of seasonal, based on seasonal requirements. SOS stands for seasonal of seasonal, based on seasonal requirements. That is the requirements that comes in line with season. So, which means we have 8 types of inventory control. We have the ABC, we have the VED, we have the HML, we have the SDE, we have the GOLF, which is GOLF, we have FSN, we have SYZ, and we have SOS. Okay, now let us look at the functions of inventory control. Functions of inventory control. Number 1, stocking of adequate amount of stocks in the store at a particular point in time. Stocking of adequate amount of stocks in the store at a particular point in time. That's 1. 2, provision of maximum supply service. Provision of maximum supply service, which must be consistent in the store. Don't forget, we are talking about the functions of inventory control. Provision of maximum supply service, which must be consistent in the store. The provision of a cushion or whatever you call it, between the forecasted and actual demand for a material. You have to differentiate between a forecasted and actual demand for a material. That is what people are requesting for. You can easily forecast what people really need at a point in time. So that is one of the functions of an inventory control. Then the last point here, one of the functions is that it gives optimal outlay of financial and human resources. It gives an optimal outlay of financial and human resources. That is, it gives us a direct information, a direct link towards financial and human resources. So in the next 5 minutes, I will quickly look at the need, the necessity for inventory control. Necessity for inventory control. Number 1, it controls stock out and understocking. Number 1, it controls stock out and understocking. Number 2, it maintains available materials. It maintains available materials. And number 3, it controls overstocking. Those are the need, the necessity for inventory control, the reasons why we really need to control inventory. Control stock out and understocking, maintains available materials, and controls overstocking. Controls overstocking. Next week, by the grace of God, we will enter into another line of inventory policy. So for now, I will give room for question time. And I believe we have just one chapter to go in rounding up with this course. So we have just one chapter to go and to round up. So we'll be rounding up at this level. I've just talked about what inventory means. I've talked about the meaning or the definition of inventory control. I've talked about the different types of selective inventory control. I've talked about the functions of inventory control and the need for inventory control. So it is question time now. Question time. Question time now. We have just 12 minutes more. Question time. Ti on mute ara mi, àbí? Mo ti on mute. Question time. If there are no questions for now, let me quickly use that to treat the next one before we round up. Factors. Yeah, my mute. Okay. Factors in determination of inventory policy. Factors involved in determination of inventory policy. I will just quickly mention and I will start explaining by next week. Number 1 is requirement. Number 2 is lead time. Number 3 is cost factors. While number 4 is liquidity / financial position. Number 5 is availability of credit factors. Number 6 is obsolescence, that is change in design. Number 7 has to do with government policies. Number 8, storage. Number 9, patient service. Number 10 and 11, marketing conditions and other factors, single source. So I will be explaining this next week when we meet, by the grace of God. So we're still having about 9 minutes more for question time before we round up. Question time. See you in a minute. question time. Hello. Báwo ṣe kìí ṣe pé mo mute ra mi? Mo ti unmute ra mi náà.
You can unmute yourself and ask your question.
I've been asking question, no response. Can you hear me?
You can hear you.
Yeah, I'm listening to their questions in case they have any question, because we have less than 8 minutes more. Hello.
Hello, sir. We are
I
online.
don't have
Sir.
question.
I don't have question, but I want to ask for the material, sir.
You are looking
Hello?
for the material.
Yes, sir.
We'll see what we can do to that.
All right,
Okay.
sir.
For you listening to the lecture,
Well, yes, but I don't really understand. But anyway, sir, just the
what
material.
and
I
what,
will just need it. Sir?
what and what did you not understand?
And there was a place you were discussing about all these
About
types of selecting inventory control that you discussed. Sir, please,
yes,
can you expatiate more on it? Types of
selective
selecting inventory control.
selective inventory control. You may
Yeah, the
not bother
types.
about the word selective. Okay,
Okay. All right, sir.
just understand it as inventory control. Okay, are you
Okay.
listening? All right.
I'm listening, sir.
We have several types of
All right,
inventory
sir.
control. Number one is ABC, which means
Yeah.
always better control. Are you following?
Okay. I'm
ABC
listening. I'm
means
listening, sir.
always better control. And
All
that
right.
is to do with annual consumption cost of the items, which does not depend on unit price of the item. Are you getting it?
Okay. All right, sir.
The
I'm listening.
second one
I'm getting it.
is BED, and that
Okay.
one stands for vital, essential, and desire. That one is based
All right.
on importance. Are you getting it?
Okay.
Of
All
the
right.
stock you
Okay,
are
sir.
going to introduce. Then number three, HMI. HML.
Is it HMI?
HML.
All right. Okay. Okay.
Okay.
Okay. Okay.
So that one
Yes,
stands
sir.
for high, medium, and low, based on
Okay.
unit price, and does
All
not
right, sir.
depend on consumption.
Okay.
Are you following?
I'm
The
listening. I'm
fourth
listening,
one
sir.
is SDE. SDE stands
Okay.
for scarce, difficult,
Okay.
and easy to obtain.
All right.
Scarce, difficult, easy to obtain, and it is based on purchasing terms with respect
Okay.
to availability. The fifth one is GOLF, as in GOLF. That one stands for government, ordinary, local, and foreign. Government, ordinary, local, and foreign. And it is based on source of supply from which material is procured. That is the sixth
Okay.
one. Are you following?
Yes, I'm listening. Sir, I'm listening.
Okay. The sixth one is FSN.
All right.
That one means fast moving, slow
Okay.
moving, and
All right.
non-moving. NON, moving. Fast moving, slow moving,
Okay. Slow
and
moving.
non-living.
Non
Fast
moving
moving,
or non living.
non-living, NON.
Okay.
Okay? And it is based
Okay.
on issues from the stores. Okay? Then number
Okay, sir.
7, I told you not to bother yourself about the meaning of SYZ. Just know it as SYZ. And it is based on the value of inventory stored.
All
Okay?
right. Okay, sir. Okay, sir.
Now, number 8, which is the last one amongst the type, we have SOS. SOS. This one is not save our solo. SOS this time around means season of seasonal. Season
Okay, season of
seasonal.
seasonal. All right.
Yes, it is
Okay.
based on seasonal requirements.
Okay.
Based on seasonal requirements. So if you are asked to identify 5 types of inventory control, these are some of the things you will make mention of. And you have to
All
tell
right.
us the meaning of the abbreviation and what it stands for.
Okay.
Okay?
All
All
okay,
right.
sir.
All right.
Thank you very much,
And
sir.
I've
Thank you.
just talked about the functions and the necessity for inventory control. I hope you understand that.
Yes,
Okay.
I understand that. I understand that.
All right.
All right, sir. Thank you, sir.
No problem.
All right. All right. It's Remila Kusa.
I can't get you.
I said it's Remila from Ikorodu.
Miracle from Ikorodu.
Remila from Ikorodu.
Hey,
Yes,
you're
sir.
welcome.
I hope you remember me, sir. Your student
I
in
think I remember that name. You're welcome.
yes, your student in other level when we're in
I understand.
that we did some course together. Yeah. All right, thank you very much, sir. Thank
All
you,
right,
sir.
all right. Okay. I think we should be rounding up now. If there is no other question, should be rounding up.